Hello everyone, welcome to the Hair Transplant Mentor YouTube channel. My name is Joe Tillman, and if you don't know what a hair transplant mentor is, you can learn all about it at hairtransplantmentor.com. Welcome to Hair Transplant Consultations, Episode 2. Right, so if you remember Episode 1, which I released just a couple days ago, we're talking about a patient that had a rare kind of pattern of hair loss where only the crown really thinned out, and it actually thinned out quite a bit, and only had a little bit of hairline recession, but the crown was the main issue. And I got some questions about that case that I thought I'd address in this video because they're interesting and they make sense. I had several people ask me, why didn't I recommend beard hair? Because the patient obviously had a strong beard, and it's quite simple. I don't believe that body hair in general or beard hair should be looked at as a primary donor source for a first-time patient. I think that those types of donor resources should be saved for further down the line once the scalp hair starts to become a little bit more scarce. And the reason being is because scalp hair is king. It is the best hair to transplant to other parts of your scalp, for the first reason being that it survives better. Scalp hair has, in the right hands, a nearly 100% survival rate, whereas body hair at best usually has 70 to 80% survival rate, sometimes lower. And this isn't about one doctor being better than the other. It's just in general, body hair on the high end can expect maybe a 70% survival rate. Beard hair grafts can be maybe 80%, but still, you also have the issues of potential texture differences from your scalp hair, the differences in how long it can grow, things like that. So that's why I don't like looking at body hair and beard hair as a main resource of donor hair, especially in a virgin scalp. Someone's never been, had surgery before, it's their first time. So that's why I didn't throw that out there. It's a perfectly viable option, but I think it's best served for once the traditional scalp donor resources have kind of reduced quite a bit. So hope that answers that question for you. Before I get onto this case, I need to say also, I'm not a doctor. I've worked in the industry for almost 20 years at a very high level with some world-class physicians. I've learned a lot from them, but I'm not a doctor. So this opinion that I'm about to give on this case should not be construed as medical advice, because if you think that it is, then that's your own damn fault, because I'm sitting here telling you it's not. So it's on you, not me. Let's jump into it. Yeah. But before we get into the rest of the video, I need to tell you about the contest. It's real simple. Grow MD shampoo. 3 lucky winners will win a year's supply of the shampoo. And the reason why I'm offering this contest is because I want more subscribers. So in order to enter, you have to be a subscriber. Don't forget to click the bell and then click all notifications, so you're notified when the special video comes out where I'm announcing the first winner. And that first winner will be announced once I hit 20,000 subscribers. We're almost there. It's like 19,218, I think, right now. But why Grow MD shampoo? Well, because I like it and I think it's worth using. Dr. Amir Yazdan, a buddy of mine from Beverly Hills, sent me a supply of it strictly with the idea of getting my opinion on it. He's just wanted to know what I thought of it, and I really like it. And so I came up with this idea. Free shampoo in exchange for subscribers, and he gets exposure for his shampoo brand. It's a triple win. Don't you want to win? Subscribe and make a comment. You gotta comment. If you don't comment, you don't win. And you can enter as many times as you want on any video I have, all of them if you want. Just comment. It's all you gotta do. Just comment. Back to the video. Okay, so we're finally talking about the patient. Patient number 2. This one is interesting. I'm trying to get like interesting cases here for a couple reasons. Number one, he represents a lot of you guys that are really young. He's 23 years old, and a lot of you that are subscribers to this channel, you're also 23, 24, 22 years old, and this is going to relate to you guys. But another reason why I think it's interesting is because of the degree of loss And well, I'll show you the first picture. So this is the patient, 23 years old, male, presenting with diffused loss, but it's advanced diffuse loss, meaning that I think there's more of a hair loss pattern visible than not. Does that make sense? It's obviously very thin, but it's thin throughout. It's not just like a patch in one area like the past patient, the last patient. But he is more thin in the back, but it is diffused throughout the front. And when we look at this photo here, you can see this demarcation line where his forehead is a lighter shade than this area. And the image doesn't have a real high resolution, but I think that the reason why we're seeing this is because he's got some fine hairs that are hanging on, kind of like an undergrowth. Like the longer hair is the forest, and these little hairs making up this darker area is the undergrowth. And I think that's what it is. But it might be from his preventative measures that he's been taking thus far, because he's been on Proscar for 6 months. Proscar, if you don't know, is a 5 milligram tablet of Propecia. It's the original form of finasteride. It's the OG, the first one that came out. It was a 5 milligram pill, and that's what he's taking. He's probably taking it in quarters, like cutting it into 4 pieces, but he didn't specify. He's also been taking Rogaine, or minoxidil, for the past 4 years. He's 23, so since he was 19. So good for this kid. He's on top of things. He's trying to fight his hair loss, and that's awesome. What's also great is that he's had PRP sessions. He didn't say how many, but he did say sessions plural, and he has had mesotherapy. If you don't know what mesotherapy is, it's the injection, in this case, contextually, it is the injection of a traditionally topical or oral medication to fight hair loss. So he's doing everything right. He's fighting this tooth and nail, so he's preparing himself for surgery. But again, he's 23 years old, and I think that now we can start looking at the other photos. This photo is just a continuation of the first one, because I was talking about how the back is thinner than the front, but you can see the diffuse nature of the loss all the way from front to back. And this isn't good. Like, I don't like seeing this on such a young kid. But the other thing that disturbs me about this is the sides of the top. In other words, this area here and here are known as the parietal humps. And if you look at a Norwood 6, that's a really, really strong, well-defined Norwood 6, you'll see that those areas will still have hair, which is the remnants of the bridge of hair that used to be there when they were Norwood 5, as they were going through the progression. His hair doesn't really have that. The loss is kind of eaten into the sides here, and I'll be able to point this out in another photo later, but the next one does show something that's promising, and that is his temple points. You can see down here, the temple point's looking good. It's strong. It actually looks like the density is really good. I see zero deterioration, and that's a good sign, because if you can save those temple points, that's less hair that needs to be used for the reconstruction of the front that can remain in the donor area for future use. So that's a good sign, but you can also see where his original hairline was down below his existing hairline. Looks like it was maybe an inch below his existing hairline, a couple centimeters, but you can still see that outline of that underbrush little hairs, which again may be from his hair loss treatments, or maybe old hairs that are continuing to miniaturize and eventually disappear. I don't know. But as we look at the other side, this one's important. This photo tells me a lot. And what it's telling me is that while it basically looks the same as the other angle photo that we just looked at, remember I was talking about the top and the parietal humps, the sides of the top? Well, as we look here, I'll zoom in on this, we can see at the top of the lateral donor area, it almost dips down. The loss, the thinning is almost dipping down into the donor region on the side. And that's not a good sign. In fact, you can see through this hair right here, but the way that's dipping down into the side of his donor region, that's not a good sign. And even though he's fighting it with medication and non-surgical treatments, I'm hoping it was worse before and it's getting better now. But yeah, I'm not encouraged by this. Like, there's a lot of bad and a lot of good, more bad than good, for this case. But let's continue. In the crown, it actually looks worse than it did before. This is a case where I think that the crown area, including the central whorl pattern, is higher up on him than it is a lot of other patients. And this, I'm not going to call this rare, but it is in the minority of cases I see where if you have crown loss and the central whorl pattern is still present, it's going to be lower down. But his loss doesn't really drop down below that. It kind of stops at that whorl pattern, at the central whorl pattern. So that's a good sign. That's a benefit because it's not creeping down further into the donor area. And while that may be good, we can see in this photo, we don't see any loss, above the comb here where he's combing. And I mean, I just don't see a lot of crown loss below that whorl pattern. But I don't like this photo because I think that his donor area looks like it's fairly thin. In other words, the density is below average, and I could be wrong, but, and I say that because the lighting isn't so great. The light is stronger above his head, so he's got an overhead light here, but it's not showing the donor area very clearly. But based on my experience, when I see this kind of gappiness in the donor area, even in less than favorable lighting, it tells me that his density is below average for the donor area. And that in and of itself, like, forget everything else. Like, this means he's not a great candidate, even if he had minor loss and was 40 years old, because his overall graft count or his overall follicular unit availability is going to be lower than someone with average donor characteristics. In fact, if his donor area were stronger, of an average density, you wouldn't have this gappiness. Instead, you would have less visible scalp, and if it was separated properly, it would almost look like a part line, like you can do on the top of your head when you got a full head of hair. I don't see that here. But before I make my final assessment on this, let's hear from the patient with some of his questions and a little bit of his background, because that might influence my final assessment. Okay, so the patient writes, I'm 23 years old and I would like to solve my hair loss problem, which causes me not only a good deal of social life problems, but also some carrier problems as I'm studying to be an actor. I don't know what he means by carrier issues, but this is a language barrier issue because he's not a native English speaker. I am living in Istanbul, Turkey, and have some doubts about clinics in my country. I've been doing some research for years and watching your videos. Accordingly, I've consulted with, I'm not going to name the clinic, but it is a clinic I work with. And the reason I'm not going to name the clinic is because this isn't about the clinic, it's about the patient. So move on. Yeah, and they recommended a non-surgical option until I get to at least 25 years old so that my hair loss is stabilized. The problem with this is that even if I understand the point of the clinic, which is to avoid any further surgeries as I lose more hair in the future, not really, but the current situation is really embarrassing. And I would really like to solve this problem as soon as possible, especially at this time during coronavirus. I get it. I've dealt with a lot of people where I would normally recommend probably not getting surgery, but because of their profession, in this case being an actor, I think that warrants a potential reconsideration. And I'm speaking generally. I'm not talking about this case specifically. I'm talking about patients that have jobs that demands that they're in the public eyes. So it could be a male model or a female model for that case, an actor or someone like that, where their appearance is part of their job and it helps them to get jobs. So I understand that, and I've dealt with many of those cases. But let's move on. My goals are, I'd like to get a full coverage on the front line temples and the crown area if possible. What do you think about my age, current hair loss, and about planning hair transplant surgery in the near future? It's like the most important question. This guy and the last guy is the first question. Like, this is something to ask at the end. So I'm actually going to wait before I answer that question. Number 2, due to my age, I've heard that to avoid the donor area becoming wide apart by time, having the first surgery to cover the temples first with FUT, and then having the second surgery, mostly for the crown, to cover the scar of the first operation with FUE technique could be more useful. What are your thoughts about that, and do you agree? Again, the language barrier thing, donor area becoming wide apart by time. I think he's saying that there could be a wide donor scar, and he's talking about FUT, and that's true. But he's also asking, can he get more grafts with FUT compared to FUE? And yeah, it can be that case, but it depends on several factors. But in general, I don't like recommending FUT for guys like him, actors, because if he needs to shave his head for a role, then that donor scar is going to be visible. So it's tough. Like right now, I don't want to focus on the manner in which we get the donor hair. I want to focus on the donor hair itself and what we're going to do with it. Next question. Let's see. Yeah, even if I live in Istanbul, once we're agreed on a specific clinic and the surgery plan, we being him in the clinic, I will try to do my best to organize my trip. I'm quite satisfied with the results of Clinic X, and my first option in mind is Dr. X and his official certifications recommendations. However, I would like to ask you about Clinic Y in Turkey, in Istanbul. If you have any ideas, here's the link of the company. I know the company very well. I know the doctor. I know the clinic. Okay, so I'll answer that question first about the clinic that he wants to go to that works with me. They're not in Turkey. And should he consider the clinic that he presented to me that is in Turkey? I think that you should go to the clinic in Turkey to get a solid donor assessment, because the clinic that you're talking about, they're good at assessing donor areas. Like they've got some advanced, I won't say advanced, but they've got some really thorough methods for determining donor density, and I would trust them with that kind of measurement, so that you could, if you wanted to go to the clinic that you're talking about or another clinic, you could take that information with you, and it would be worthwhile. Like the other clinic will be able to look at it and say, okay, well, this is what they said, so this is trustworthy. We understand that. And that helps doctors to make a solid assessment for what's possible. So I think it's a little bit of both. Go to the local clinic in Istanbul to get your donor area assessed, and you could consider them like they're a good clinic, or take that information to the other clinic that works with me, and like you obviously chose them for a reason because of the naturalness and the results that they're getting. So maybe that's a clinic for you. I don't know. I'm not going to tell you which one to go to, but I am going to tell you, go to the clinic in Turkey to at least get assessed for the donor region, because it's important, especially in your case. Okay, so let's go back to the first question, which is the most important. What do you think about my age, current hair loss, and about planning hair transplant surgery in the near future? So let's recap. He's 23 years old. He has advanced hair loss. Like when I was his age, I had more hair. And I'm talking, well, when I was 22, before my first hair transplants, I had more hair than him. And look how I turned out. Like, I'm not talking about this. I'm talking about 10 years later, I was bald as hell, and I had nasty, like, grass sticking out my forehead, and it was just like I was miserable. So that's where you're going to be in 10 years without surgery. Like, you're going to be bald. You're going to be really bald. And that's not, it's not taking into account your preventative measures. But if you weren't doing anything to fight hair loss, then you would be really bald in 10 years. You'll be really bald in 5 years. So that's something to keep in mind, because all the treatments that you're taking and medications that at most might just keep things where they are, but I don't see them turning things around drastically. Any benefits that you get is a good benefit, obviously, and can help, but don't expect miracles. Because you're 23 though, and the clinic that you're talking to, your primary clinic, is suggesting wait till 25, I think that that's a good idea, but not because of what they're saying. Not for the reason of stabilizing your loss, because you've already said that you think that your medications and your efforts have stabilized your loss. Like you feel like your loss has not progressed, and that's great. And I do think that you need to keep doing that to get a stronger sense of what the future is going to hold for you as far as your recovery, because you just started ProScar, you've only been on it for 6 months. Give it a full year. You might have a benefit that can reduce the number of grafts needed to address the loss. And that's one of the reasons why you want to take medication, because it can actually save you money in the long run. Doesn't hurt. But the other reason why I think you should wait till you're roughly 25 is because you got other treatments to try. Like you can try laser cap, you can try exosomes. You're doing PRP, but you can maybe try exosomes. But more importantly, I think that you should try a hair system, a wig. Now I know that there's a lot of stigma with hair systems and wigs, but you'd be surprised in the acting community in Hollywood, in New York on Broadway, there are a lot of actors that are wearing hair systems. In fact, even actors that have a full head of hair will sometimes wear a wig, even though that wig is supposed to look just like their regular hair. It sounds weird, but I noticed this recently in one of the Captain America movies. Like Chris Evans, he's got a good head of hair. But I noticed in a couple of scenes, his hair is a wig. But then in another scene, his hair is not a wig. It's his regular hair, maybe with some fillers and stuff in it. But that's just one example. And I think that for someone like you, your appearance is your moneymaker, aside from your acting ability. Like it's your acting ability and your appearance. So I think that you'd be surprised at how good some of these hair systems are. And if you find the right supplier, they can be fairly cheap, and it'd be cheaper than a hair transplant. And you have options, because if you're wearing a hair system and you get these great roles, and then one day you get a script where your character is bald, like shaved head bald, what are you going to do if you have a strip scar or you have a bunch of FUE scars all over the back and the sides, drawing attention to yourself? Like that's not something you want. I've seen actors with strip scars, with shaved heads. It's not a good look. So I think that that's something you should try. Give it a few months, maybe 6 months or a year, trying this out, finding the right system for you, getting used to it. And then if it doesn't work for you, then you can consider going the surgical route. But I got to tell you, the surgical route is not a great route for you, because your expectations, you're looking for temple work, you're looking for hairline work, you're looking for crown work, you're looking for everything work between a lower hairline and the back of the crown, and you're 23 years old. I don't see it in your future, man. Yes, you could use body hair. Yes, you could use beard hair if you have it. And then you're chasing the result. You're always trying to get to the point where you've got the density and the coverage that makes you happy. You have below average donor density. You have a large area of loss. Your hair caliber, the texture is fine, which means that your hair shaft is it's got a small diameter, even compared to mine. Your hair looks like it's finer than mine. And finer hair needs more grafts to get coverage and density. So the odds are not in your favor. And I think that the hair system route will get you what you want a lot faster than anything else. You can have it tomorrow, hypothetically, if you could find the right supplier and shop that would blend it for you. But that's it. I don't think that you're a great hair transplant candidate. I don't think that you should have surgery at all. And I hate saying this because I know what it's like, especially at your age, to lose so much hair and to be in a position where it actually benefits you more than the average guy because of your profession, being an actor. So, and then there are the social aspects, and you're wanting to fit in and meet girls or maybe guys, I don't know. But I get it. And I don't like saying these things because I know how hard this is for you, but it is for your long-term best interest. I think if you can do that hair system thing, it might actually make you a lot happier. If you aren't a subscriber, hit the subscribe button, please, because it's important for my channel. And of course, if you do hit that subscribe button, click the bell and make sure you ring that the option for all notifications, because that's the only way that you'll know when a new video comes out. Just clicking subscribe doesn't do it. You gotta take one more step. And if you do that, then you'll be able to get notified when the video comes out where I'm saying you want a year supply of GrowMD. So it's in your best interest. Do it! Thanks for watching. Peace.